We've done 5 questions. We are going to start again with Mr. Scott for the 6th question, and then we will have closing remarks, and we will do this in the order, so we will start with you, Mr. Moody, to do the closing remarks. So question number 6, in 2009, 7.9% of Maine high school students reported attempting suicide. How will you meet this challenge, and what specific initiatives will you propose and support to improve the mental health of Maine's citizens?
You know, this is another example of how I am different and how my thought process is that process which we need to bring into a leadership position in a state like Maine, where we have a lot of private solutions out there that are not being championed. We need a governor who communicates, who gets it. That is definitely me. I look at this question, and it seems to be indicative of the problem. What specific initiative will I propose and support to improve Maine mental health care for Maine citizens? You know, the question really needs to be, not a criticism of your question, by the way, but it's not acceptable any longer to direct to us how we are going to drive the bus. You folks are willing and capable of taking that wheel. You need somebody who's going to maintain and keep that thing running and let everybody know it's on the road. That's me. The question really needs to be, how will I support those groups that seek to improve mental health of Maine citizens? Period. And that's what I will do. I will become a champion. I will reach out and hold up as examples those folks that are working in mental health here in Maine. I want to say this very clearly as well. There's a lot of conversation in this year's race about welfare. Well, here's some late breaking news. Mental health care falls under that category. Do we want to kick that to the curb? I know that we don't. Adults suffering from mental health care need treatment. Through that process, they can be stable parents. They can have the services they need to maintain their dignity and integrity in their work environment. But when they go untreated, as the police officer in Brewer, Maine said to me, my biggest issue is dealing with mental health care patients. I'm a police officer. I'm looking for the bad guys, not the folks who need our help. I'll make sure to turn the question around and bring the solutions forward from Maine.
That was good. Good. You know, let's face it, we live in an increasingly complex and diverse society. You know how we were often asked, geez, wouldn't you like to be 16 again? I don't know, really. Knowing what we know out there today, and you can't take what you know now back. I think really, mental health is just, it's been stigmatized for generations. And it really gets down to education, awareness, and acceptance. You know, if you fall down off this stage or break your leg, God forbid, but you know, you get cards, you get flowers, you get somebody right on your cast. If your mind's broken, everybody's gonna head for those exits. I mean, that's the stark reality. So we need to heighten our awareness at the early ages, the young ages, so people will be more socially accepting of the fact that, you know, we're not all genealogy the same. You know, we all have our strengths and our weaknesses, and knowing at that early age, that's when it's detected. How many tragedies have occurred in Maine where you look at a functioning family and there's a suicide, and the parents had no idea. It just happens. But if those kids' peers, their friends, their classmates had the awareness raised to the point where they could intervene or let another teacher know or their parents know, so we could catch people before they fall, that's the real key to mental health in Maine, and it definitely needs to be supported. And exactly, that is a campaign issue. You know, if we're going to go in and cut this, cut that, I'm asking, we're going to grow our way out of this, because we can't afford to cut our social safety nets in this state. Thank you.
Thank you. Very, very tough question for any single individual, whether a governor or doctor or parent, to answer. But we really have to be better at at identifying potential problems out there. And we do that, I think, with having access to crisis and counseling, to mental health services, and to supports for families who are struggling. There's another issue which we haven't touched on about this. Many of these attempted suicides are caused by lack of social acceptance, lack of diversity acceptance. Many young people who struggle with their sexual orientation, for example, are ostracized in their classrooms without the proper supports that could lead to an attempted suicide. That's, of course, not the only thing. And I think Sean was very sensitive about that. To stigmatize mental illness is such a mistake. I'm so pleased that in Maine, long ago, for insurance policies, we include help for mental illness along with diabetes and heart conditions. Probably each of you knows someone or has someone in your family who has needed mental health services. I certainly can make that claim. All of us can do that. But more importantly, how do we provide the supports, the healthy supports? A classroom, for example, for a young person where guidance counselors are very keen on recognizing symptoms and then can reach out to the professionals who can help. Certainly, it is a scourge of our society. It is not new. It is equally horrible because we have not been able to stop it. But this is something that's going to require both the community supports as well as government supports and certainly the leadership of the health community.
Actually, the state of Maine, about 25 years ago, walked away from mental health. Half our jails, half the prisoners in our jails have suffered from mental illness or some form of mental deficiency that we just throw them in jail and we walk away. I've been working the last 10 years in Waterville with a program called the High Hopes Clubhouse. And we've opened one up in Augusta now. And what we deal is with people with severe mental illness that have been at one point hospitalized. Then we take them into the clubhouse. We work with them to teach them how to live independently. Then we work with them on how to get into jobs. Last year in 2009, 21 people of young adult age, meaning between 18 and 30, 21 people who had never had a job in their lives earned $439,000 in gross revenues. That's what we need to be doing. And we need to be doing that in every community. In fact, we have been so successful at our company that we received a national award for the work we do with mental illness. But it's about caring in our schools, in our homes, and in our communities. And the other thing we have to do, and I'll go back to jobs again, if our families didn't have to work 2 and 3 jobs to make ends meet, if we had 2 parents in our homes, we would have a better defense.
Everything my friends here have said is right. We're in Maine increasingly, I think, a disabled and dependent population. And when you have a problem like that, the very first thing you have to do is you have to blow open the roof. You have to give people opportunities to fulfill their potential as human beings. That means jobs, that means opportunity, that means a growing economy. But the other thing you have to do is you have to build a floor. And you have to make sure that people don't fall through the floor. Today in Maine, we have a constellation of problems: suicide, domestic violence, and acute mental health disability. And when suicide is the second highest cause of teenage death in the state of Maine, something is wrong. We've got to move aggressively at these problems, and it's not just opportunity, it's getting in there and stopping the cycle from continuing. 3 suggestions. First of all is Bob McAfee, when he was president of this organization, made domestic violence a cause. And this, I would commend to you, make screening a cause. Screening for domestic violence, screening for mental health problems, and screening for suicide. One child in the Teen Screen program, which was started at Columbia and is now at 6 sites in Maine, one child in the Teen Screen program said, when asked why he didn't say something, he said, because no one ever asked. Second, let's make our schools community centers. One of the problems with consolidation is that we not only take a school out of a community, we take a community center out of a community. And we've got to go back into the schools and make the schools part of this strategy. And third, let's create an accountable care organization framework in Maine, which is what I've suggested in Maine Wellness, so that we can get at physical and mental health together, so that we can deal with underlying family problems, so that everyone has a medical home, and so that we don't let people fall through the floor.
Thank you. Well, we finished the question. No, we've got one more question. Sorry.
No, but I'll go again if you'd like.
So we
Happy to.
finished the questions.
Thank you.
And these were tough questions, and thank you so much. You really, you did your homework, and we appreciate it. Thank you. And now we'll start with Mr. Moody for our closing
You can
comments.
call me Sean. That's
Sean.
fine. Wow, we've digested a lot, heard a lot. When I first came in the room, I said, you know, we really should be listening to you folks giving the presentation to us, because it's you guys are very passionate about what you do. That's why you're here. That's why you work hard every day to promote the best and healthiest Maine that we can possibly have. And Maine is centered around the quality of life. We don't live here because it's cheap. We don't live here because it's easy. We live here because we love the state and we love the people in the state. And as governor, we're going to bring a new attitude to the Blaine House. It's going to be one of growth and prosperity. Too often now, we're band-aiding and on the peripherals of our problems. The solutions lie in front of us, but we got to get to the root causes, because otherwise we're just continuously chasing the outcomes. We can create the outcomes that we want by being disciplined and vigilant in our policy, how we set ourselves as role models. And the most important thing that we are facing in the state of Maine today is reinvigorating the entrepreneurial spirit in the state. When I was 15 years old, I was that kid in the classroom that was drawing on the piece of paper, looking out the window, dreaming about starting my own business. Well, guess what? Before I graduated, I made it happen. I didn't wait for that ship to come in. I swam out to it. And I am just of one. We employ 75 people, have a payroll of over $4 million. Our health costs have not risen the last 3 or 4 years. Why? Because we have a healthy, active, high-performance work environment. And that's what we need to implement into state government and into the business community in Maine to get our young people growing so they can be hopeful, provide the opportunities they need to start their own businesses and hire their friends and push productivity and push the economy of Maine forward. We have everything we need, all the natural resources. We just need a leader that's going to make it happen.